Gano, Sego, welcome everyone. It's a new week and we have much to discuss this day, so let's proceed. I'm Lori Davis Hill, Director of Health Services and Incident Command for the pandemic response at 6 inches of the Grand River during the course of the community emergency. This is your COVID-19 update for Monday, May 25th. In today's podcast, let's make mention to our families and friends across the border and say Happy Memorial Day. I hope those of you who missed out last weekend received your bread and cheese at Bread and Cheese 2.0 this past Saturday. In lieu of a guest today, we have some new things to share. We are now reporting another confirmed positive COVID-19 test as of Sunday, May 24th. Even though the hot weather is here, we must stress that we have to be alert to the presence of the COVID-19 virus. Our community cannot sustain the onslaught of this virus, and that's why it's so imperative that we follow our public health measures. We do not want this to be the beginning of a summer of sorrow. We remind our community to wear a mask if you must go out in public. Take every measure to stay home, especially if you feel ill. Practice physical distancing of at least 2 meters. Wash your hands in warm water and soap for a minimum of at least 20 seconds or use alcohol-based hand rub. Cough or sneeze into your elbow or sleeve or a tissue. Throw the tissue into a waste paper basket and wash your hands. Clean and disinfect commonly touched areas in your home and workplace often throughout the day. We do not want a situation that many of us saw in Toronto over the weekend, huge crowd gatherings in a park, which is the perfect scenario for a super spread of this virus. Many have noted that primarily it was the young age bracket persons involved, but what they did not realize that inherently the virus can travel through them to their parents and grandparents. It must be reminded to all that COVID-19 is a deadly respiratory disease that can wreak havoc if not taken seriously. It can rage without regard for anything, as we have seen in Latin American countries, notably Brazil. Until we have this virus under control, please continue to follow public health measures. Now on to our numbers. As previously mentioned, we here at Six Nations are now reporting an additional positive case. This increased our case count to 13 cases. 10 have resolved, and we have reported one death. Test administered to date number at 662. Tests completed. We are waiting on results, but we can now share that 561 tests have come back as negative. 56 people have now been directed into self-isolation by Oswego Public Health. Looking at our immediate and surrounding communities, Mississaugas of the Credit remain at one positive case reported. Haldimand Norfolk Public Health Unit report 210 cases, 93 resolved, and 31 deaths. Brant Public Health Unit reports 108 positive cases, 93 resolved, and 4 deaths. Hamilton Public Health Unit reporting 647 cases, 421 are resolved, and 32 deaths. And Toronto Public Health now reporting 10,035 positive cases, 7,397 are resolved, with 759 deaths. Also, I am now hopeful that everyone is aware that the Premier has said that anyone who wants to be tested can be tested. That's true here at the assessment center. If you want to be tested, call the hotline. If you have any kind of symptoms, please call and you will not be turned away. The symptoms of COVID-19 include fever or chills or a temperature of 37.8 degrees Celsius or greater, new onset of cough or worsening of chronic cough, shortness of breath or difficulty breathing. Other symptoms of COVID-19 can include sore throat, difficulty swallowing, loss of smell or taste, nausea, vomiting, diarrhea, abdominal pain, runny nose or nasal congestion, in the absence of underlying reasons for those symptoms, such as seasonal allergies of postnasal drip, etc. Atypical signs and symptoms of COVID-19 to consider in children, elderly, and people with developmental disability include unexplained fatigue or tiredness, delirium, headaches, acute functional decline, exacerbating chronic conditions, chills, croup, pink eye or conjunctivitis, and multi-system inflammatory vasculitis, including a rash, lethargy, and difficulty feeding in children. Let's do our best to keep Six Nations COVID clear. If you want to be tested, you are welcome to get tested, and you can call the Six Nations COVID-19 Assessment Center at 226-446-9909 or toll free at 1-855-977-7737. The COVID-19 hotline is open 7 days a week to take your calls. And now until tomorrow, here are some announcements. The Six Nations COVID Relief Fund has been announced, which we use to purchase much-needed personal protective equipment, medical supplies, including equipment to maintain essential pandemic operations, as well as food and necessities for many community members who are facing financial challenges. The fund is being administered by the Royal Bank of Canada, and contributions can be made through electronic funds transfer at the email covidrelief@sixnations.ca. Public Works has put out a call for homemade masks, and all donations are greatly appreciated. For more information on that, please call 519-445-4242. And if you would like to connect with the Six Nations Mobile Crisis Service, you can do so by phone at 866-445-2204 or 519-445-2204, and that's available 24 hours a day, 7 days a week. You can contact them by text Monday to Friday, 8:30 to 4 p.m. at 226-777-9480, or by live chat Monday to Friday, 8:30 to 4 p.m. And you can find that on the Six Nations COVID-19.ca website. Now more than ever, our frontline workers are helping to keep us safe against COVID-19 here in Six Nations. We are saying yawa to them with signs on our lawns, but if you know a frontline worker personally, say thank you to them. It really means a lot and gives them the motivation to continue doing what they're doing. Remember, for our frontline workers here on Six Nations around the world, and for our paramedics, and it's Happy Paramedics Week. So look for some of their news on our social media. So please stay home for them. Please stay home for all of us. Stay well and stay safe. Yawa.